Test, test. Test. It's very good morning, colleagues from the international media. Thank you very much for participating in the third weekly virtual meeting. And I hope that everyone is doing well and keeping fit. Colleagues, last week I briefly mentioned about the synergy between the central and local government to ensure that the policies and effort to fight COVID-19 and its socio-economic impacts work well. So synergy is key. Therefore, I'm very pleased to have General Tito Karnavian, Minister of Home Affairs, with me today. Minister Karnavian will brief you on how the local government works hand in hand with the central government and how the local wisdom and values contribute to address this challenging situation. And I'm also pleased to once again have Professor Wiku Adisasmito, Chair of the expert team of the National Task Force for the Acceleration of COVID-19 Mitigation. And before I give the floor to Pak Tito, allow me to convey some information and updates. My first point, in the last few days in Jakarta, you have seen the number of new COVID-19 cases slowing down and more people recovering. These are, of course, very encouraging signs. However, we will not be complacent despite this development. We will monitor further development of cases in other parts of Indonesia so that the local governments can better prepare in fighting against COVID-19. That is why, based on the request of the local governments to the local governments, the central government has issued large-scale social restriction in various regions that we consider as red zone, following the increase of confirmed cases in the areas, thus allowing those regions to contain the spread within its region and to contain spread to other regions. My second point, the Minister of Transportation had issued Regulation number 25/2020 on the 23rd April 2020 on the transportation management during mudik period. This regulation is part of our strong effort to curb the spread of COVID-19. What I would like to underline here is that this regulation excludes the international flight, cargo flight, as well as domestic flight from non-red zone areas. Furthermore, the regulation will not hamper the flow of goods in Indonesia, including during Ramadan and Idul Fitri. This is important point that President Jokowi always reminds all the cabinet members. My third point, we are fully aware of possible risks related to imported cases, including from Indonesians returning from abroad. Therefore, there is no other choice for Indonesian authorities but to strengthen the health protocols upon their arrival in Indonesia. Yesterday, we had another special meeting chaired by the Coordinating Minister for Human Development and Culture to discuss, among others, strengthening health protocols at the entry points in Indonesia. To give you an illustration on how many Indonesians are returning, from Malaysia alone, Since 18 March until 29 April, around 68,614 Indonesians have arrived from Malaysia by sea, land, and air transportation. And then around 11,864 cruise ship crews from 17 countries have returned to Indonesia so far. As much as 1,381 Indonesians from many parts of the world have also returned back. Furthermore, the Indonesian Agency for the Protection of Indonesian Migrant Workers estimates that approximately 33,000 Indonesian workers abroad, I repeat, 33,000 Indonesian workers abroad will have their contract expire in 3 months. While now we also expect another 2,339 cruise ship crews returning home. So to mitigate the possible risk of important cases, the government have issued several policies. First, we need to make sure that all incoming Indonesians comply with all mandatory health protocols, especially at the point of arrival in Indonesia. And we try to do the same at their point of departure. Second, we have designated entry points for Indonesian returning home by air, Jakarta, Bali, Makassar, Medan, by sea, Batam, Tanjung Priok, Benoa, Dumai, and Tanjung Balai Karimun. Third, at each entry point, there will be dedicated quarantine facilities for those who have symptoms. We also dedicate transit facilities for incoming migrant workers before they go back to their homes in various areas in Indonesia. For those Indonesians who do not have symptoms, they are strongly encouraged to conduct self-quarantine at home for 14 days. The local government, or even at the village level, will also mobilize efforts to ensure quarantine measures are complied. And Pak Tito may explain about this later. So understanding the magnitude of this challenge to break the chain of the spread, this is where strengthened synergy between central and local government can prove to be vital in the fight against COVID-19. Colleagues from the media, my fourth point that I would like to share today is to update on the international cooperation related to COVID-19. In the last 7 days, President Joko Widodo has been in close communication with other leaders, with the President of the United States of America, President of South Korea, Prime Minister of Japan, Prime Minister of India, and the President of Iran. Through these meetings, the President underlined the need to address shortage of medical supplies and medicine, including through innovative cooperation for joint production, and then the importance of expediting research for COVID-19 vaccine and also ensuring equal access to medicine and COVID-19 vaccine once it's found at affordable prices, and the importance of enhancing cooperation to mitigate economic impact of COVID-19. On my end, I continue to engage with fellow foreign ministers through various virtual engagement. The ASEAN-US Foreign Ministers meeting on COVID-19, the weekly Ministerial Coordination Group meeting, and the last one was the phone conversation with Foreign Minister of UAE. on all my communication, I always mention about vaccine. Yesterday, during the press briefing, I mentioned that under this current situation, Indonesian diplomacy has and will actively strengthen multilateralism with the ultimate goal of creating fair access for developing countries and LDCs to vaccine and drugs at affordable prices. So, colleague, that is all from me, and now I have the honor to invite Minister Tito Karnavian, Minister for Home Affairs, to convey some information. Pak Tito, the floor is yours.
Thanks very much indeed, Ibu Retno, Minister of Foreign Affairs of Indonesia, my colleague. Ladies and gentlemen, good morning. What I'd like to share with you this morning is that in relation to my role as Minister of Home Affairs, my main role is that to supervise and oversight the local governments. So in Indonesia, we have got 34 governors, provinces, and also 514 regencies and cities led by either head of regency or bupati and mayor. So since the beginning of the outbreak, what I'm going to do and have done to the local governments is that to build awareness. This is a very important point, because if you've got the same mindset, then you can interpret and explore on the operational and tactical level in parallel from local government to other local government, and from local government to central government. So the way I build up the awareness is that to wake them up with the sense of crisis. The narrative I build up is that we have got a crisis, we have got a global crisis, and this is the widest pandemic we have ever since humankind present. Well, we have got a number of pandemics before, such as Black Death in the 14th centuries, to that suffered Europe and Central Asia and claimed 70 to 200 casualties, fatalities I mean. But again, in terms of size of area, only covering Europe and Central Asia. We have got also another pandemic which is also claiming a huge number of human beings, Spanish flu, 1917, 1919, claiming almost 70 millions. But again, it's not wide enough compared to COVID-19 that covered and affected almost all countries in the world. But today, as far as I know, 213 countries in the world already affected. And again, this is the first time in the history of human being we have got almost all countries in the world affected by a single pandemic, namely COVID-19. Similarly, in the case of Indonesia, this is the first time ever since independence of Indonesia, 1945, we have got pandemic that has affected all provinces in Indonesia and almost 300 cities and regencies. All provinces. We have got a number of outbreaks before, such as dengue, malaria, but mostly local or affected a few provinces. But again, it is first time ever COVID-19, all provinces in Indonesia affected. Then it is multi-dimensional crisis, because starting from the health crisis, so it is creating a domino effect in which then you have got another domino already affected, namely financial crisis, because of the revenue also being plummeted. Then it can go down to the next domino economic effect. That's why the government already launched social safety net to net and to stop economic crisis becoming a social crisis that can go to the security crisis. So sense of crisis is very important to be informed to all heads of local government, so they are aware. Why sense of crisis is important? Because it can affect also the mindset, the way of thinking. If we have got a sense of crisis, then our mindsets would be overreactive or overestimate rather than underestimate or underreactive. When you have got the overestimate mindset, then you will prepare the worst scenario. You know that COVID-19 outbreak, based on the studies and also lessons taken from other countries, mostly the graph is exponential. It is growing, rising very rapidly and dramatically because of the spread of contagion. So it's better to have a mindset of overestimate, then you will prepare everything, and it can also dictate your operations and tactical level in such a way, just in case you have got worst scenario, you have been prepared. On the other hand of the coin, if you are thinking it is not a crisis, you are staying relaxed, then, well, even though it is natural, you are relaxed because you are thinking it is not your problem until the problem already in the face of yours. So, if the mindset is underestimate, then you are not prepared for the first scenario. Every effort you have done or you are going to do, mostly minimum. Again, as the result, then you are panic or not ready, not prepared if the scenario really come up on your face. So this is the way of thinking I shared with all heads of local governments. Then I developed also, I already instructed to heads of local governments in preparation of overestimate. We have to do it systematically, even though local government, of course, since Indonesia is now being decentralized, mostly decentralized, except six affairs: defense, security, foreign politics, then religion, legal system, but mostly other affairs in the hands of local governments. So local government already responded to the outbreak according to their wisdom or their own judgment. So as a central government, Minister of Home Affairs trying to provide a guidelines in which local government have got almost similar system of management, could be templated and copied by one to another. So there are 5 prongs of strategy in the management in handling of COVID-19 and its impact. Number 1 is that the strategy of containing the spread. So containing the spread is very important, and it is the main job of us, because this is the main enemy, the virus. We have to contain the spread of the virus, whether it is from socialization, to educate people, testing, tracking, physical distancing, wearing mask, and also some restriction, such as home quarantine, hospital quarantine, area or territory quarantine, and what we call is PSBB. This is the restriction for large-scale social gatherings. This is the cluster of strategy number 1, containing the spread of the virus. Number 2 is that to improve the immunity system of our citizens. So we have got only 2 scenarios. You are being affected or infected, then you try to avoid being infected until somebody got the vaccine or have got the medicine for that. But second scenario, given the fact that the contagion is very easy through 3 methods, I believe all of you already know that then you have got infected. Once you have been exposed, the scenario we are hoping is that your immunity system is strong, could produce antibody, that it could kill the virus inside the body. So improving the immunity system of citizens, such as encouraging citizens to do exercise regularly, consuming nutrition, plus vitamin, such as vitamin C and E, sufficient sleep, for instance, less stress in life, having a good lifestyle, which is very important to boost our immunity system. This is the second strategy. The third strategy is that to improve and increase healthcare system. We need to provide and add some more medical personnel, including volunteers. Improvement of health supporting facilities for quarantine, emergency hospitals, in all areas, in all local government. Then, of course, improving the testing method, providing some more labs. They fall into category of improving the capacity of healthcare system. Just in case we have got worse scenario, casualties curve is rising, they are still below the capacity of our healthcare system. Number 4 is that the impact. The impact, particularly, we have to prevent the crisis to be a social crisis. That's why we need to provide social safety net, whether it is by cash or staple foods, particularly for less fortunate people. And number 2, we provide also assistance that our business, whether it is a big business, more specifically a medium scale business, and micro and ultra micro business remaining survive. Because otherwise unemployment could be rising, then it could be another generating another problem for us. Social safety net and economic effect of the crisis being considered and need to be addressed as well. This is the 4th strategy. And the 5th or the last strategy is that to improve our food security and health industry. Food is very important. In this COVID-19 crisis, in my personal view, there are 2 items are urgently needed by people. Number 1, anything relating to fighting against the COVID-19, health. And number 2 is that things relating to our tummy, food. People really in need in food. They are scared with COVID-19, but they need something for their tummy so that not to be hungry. When you are hungry, you can be very emotional, even can get killed as well. So food security is very important. That's why we encourage all local government to provide anything they can do, again, to fulfill the requirements of the people, of their own people in their own local governments, in their area, to have sufficient food. And Indonesia is blessed by the God that since it's located in a tropical area, we have got sunshine throughout the year. We have got a fertile soils, more than 100 volcanoes we have, even though we are put in the ring of fire. But the good side of it, again, the fertile soil, so people can grow anything, particularly the quick harvest products, plants, such as sweet potatoes, cassavas, paddies, vegetables, fruits, and we've got abundance of ocean or sea products, such as fish. Now we have got oversupply of fish, again abundance. Since the chain of supply, particularly for the market, restaurants, hotels, most of them suffered and closed. So we have got an oversupply. So we encourage local government to trade with provinces with the oversupply of sea products to fulfill, to meet up the requirement of protein for their citizens. And also health industry. Why health industry? You know that Indonesia has got a lot of raw materials for our health industries. Everyone now needs hand sanitizers, alcohol. So we have got again abundance. We are a green country, abundance of raw materials such as palm plants, coconuts, fruits, everything can be converted to be alcohol. And again, to be converted to be hand sanitizers or alcohol-related products to kill the virus. We are also the biggest producer of palm oil. And you know, palm oil can be used for many kind of things, from oil to margarine, ice cream, vitamin, soap also. You know, the virus, you know, is very sensitive to soap, whether it is hand soap or washing soap, whatsoever. We have got abundance. Indonesia is number one. What we can do is that, what we need to do is that to encourage the owner of palm oil companies from only producing and exporting crude palm oil to produce, you know, the things that relates to the COVID and also for food. So there are 5 prongs already introduced to local government. Now the local government already work, and in order to execute the 5 strategies within the management of COVID-19, they need, of course, money, budget. So the President already issued an instruction, number 4, 2020, and then follow up by Minister of Finance, producing a regulations, Minister Regulation number 6, 2020, and myself also produced regulations number 20, 2020, to instruct local government reallocate and refocus their local budget to 3 things. Number 1, relating to health. Number 2, whatever relating to social safety net. And number 3, economic impact, particularly again to assist and to help the business people, particularly the middle income or medium scale and micro and ultra micro business remaining survive. So for the time being, we have based on our data, in total, local government already provided some 63 trillion rupiah, divided into 3 for healthcare improvement, capacity improvement, some 25 trillion rupiah, social safety net, some 26 trillion rupiah, and almost 8 trillion, I repeat, 10 trillion rupiah for economic impact. So along with the central government already reallocate the central government budget. We are hoping that this sort of reallocation, both central and local government, can fulfill any necessity, any requirement in fighting against the COVID-19, hand in hand, central government and local government. And Ibu Retno just mentioned and already pointed out that, well, God willing, that the number of confirmed cases and fatalities can be going down, and we suppose also that it is still going down, then we could contain the problem. Thanks very much indeed. Bapak Wiku, I return to Ibu Retno, please. Please, sorry about that.
Well, thank you very much, Pak Tito. Colleagues, now, as usual, we move on the Q&A session. And so far, we have received questions from 11 media: Sydney Morning Herald, New York Times, CNA, Moroccan Press Agency, AFP, China Central Television, Sky News, ABC, NHK, Straits Times, and Nikkei. And Minister Tito will answer questions related to social restriction measures, and Professor Wiku will provide you again updates on technical data and details. And for my part, I will address questions in the main three clusters. First cluster is question related to the balance between public health and economic interests. And then the second cluster is related to international cooperation. And then the third cluster is about foreign nationals in Indonesia. So let me start with the first question, especially this answer is to respond to the question from the AFP on how Indonesia government balances between public health and economic interests. Colleagues, since the very beginning, President Jokowi has stated that the public health is Indonesia priority number one. So health and safety of the people is our priority. A healthy society, a healthy nation must firstly be ensured prior to discussion on other aspects. But at the same time, everybody knows that the socio-economic impact of COVID-19 is tremendous. Therefore, governments around the globe have to design policies to ease the burden of the people through stimulus policies and mitigate the economic downturn. And last week, you listened to the explanation of Minister Airlangga Hartarto on the government economic stimulus packages. Yesterday, during the cabinet meeting led by President Jokowi, we discussed policies to assist micro, small, and medium enterprises, MSMEs. And this is part of the government effort to defend MSMEs' financial capabilities. Among the policies that taken by the government is the 5 large scheme to sustain the activities of MSMEs. That is through social assistance program, or we call it BANSOS, tax incentive, relaxing credit, financing, and reallocating local government funds toward MSMEs. And indeed, there is tremendous potential for MSMEs to assist in the growth of the national economy. And as you know, that the MSMEs in Indonesia is one of the backbone of our economy. And then it brings me to the second question, that is the question from Sydney Morning Herald, New York Times, CNA, and Moroccan News Agency. The question is related to the progress of the international cooperation and the phone call between President Jokowi and US President Donald Trump. On the last point, President Jokowi has been in close communication with various international leaders I mentioned during my briefing. And all of this communication, President Jokowi consistently highlighted three main issues. I had mentioned it in my briefing also. But on top of those three main issues, President Jokowi usually also mentioned about the protection of Indonesian citizens, as the President conveyed during the phone conversation with Prime Minister Modi 2 days ago. So back to the phone conversation with President Trump, the two leaders compare notes on the situation of their respective country and their effort to fight against the virus. As you know, colleague, that the US is one of the most important partners for Indonesia. And the two leaders during the phone conversation underlined the importance of maintaining this good relation. And then on the issue of international cooperation, to date there has been support for COVID-19 medication in Indonesia. In all of this, 94 international partners have been involved, comprising of 9 countries, 9 international organizations, and 76 NGOs. For example, with China, G2G support has been delivered in the form of medical equipment and PCR test kits. B2B linkages in the area of medical supplies have also grown significantly, and moreover, our two sides are exploring potential cooperation in the development and production of COVID-19 related medicine, including, of course, the vaccine. We have also such good cooperation with other countries, among others with Japan, ROK, and also the UAE. And then responding to the ABC question on the issue of returning Indonesian crew and delays for the ship to dock at the Indonesian port, I have explained it to yesterday, actually, during the briefing yesterday, I have explained about this issue. So what I would like to underline is that we must stress that the disembarkation process requires careful technical preparation, including fulfilling mandatory health protocol. Such process cannot be rushed. The process required synergic coordination among various actors from the central and provincial governments. And furthermore, planning for this process must take place even before the cruise ship departs its port of origin. Indeed, colleague, there is a surge of cruise ship arrival in Indonesia because other countries have been reluctant to allow their ship to dock and at their port. I would like to repeat it again. Because other countries have been reluctant to allow this ship to dock at their port. We have tried to facilitate the return of Indonesian crew using charter flight. However, this requires flexibility on the part of other countries visited by this ships. And lastly, to respond to Sydney Morning Herald question on the current number of sick foreign nationals in Indonesia, as of yesterday, 29 April, there were 569 COVID cases of foreign nationals in Indonesia. 94 are positive, 306 are people under surveillance, or we call it ODP. 149 have recovered and 17 death cases have been recorded. So I do hope that I have answered all questions directed to me. And again, I would like to invite Minister Tito Karnavian to respond to the questions addressed to him, and then after that will be followed by Professor Wiku. Pak Tito, dipersilakan.
Yes. Thank you very much indeed again, Ibu Retno. Ladies and gentlemen, colleagues, I've got a number of questions here in relation to my role as Minister of Home Affairs. Number one is that how well are restrictions upon mudik or going home village and prayer gathering being observed? Shouldn't every region implement clear physical distancing measures such as not holding mass prayers, no group gatherings, to prevent region becoming a red zone? So these questions being asked by CNA, Sky News, and New York Times. Well, number one, in relation to the home village or mudik, going home village, the government, central government particularly, already applied what we call is stage-to-stage strategy. Because we are taking the lesson from other countries in which applying or issuing too abrupt strategy that could impact a massive number of people, sometimes it can produce counterproductive rather than really productive. It could create chaos, panics, and so on. Once you apply a policy, then people will not be ready with that. Then they are panicking and even going home to their own villages because there is no hope in the big cities since they lost their jobs and so on. So it happens in some countries. Well, I'm not going to mention to specify what countries really experiencing this kind of things. So taking the lessons from this issue, so central government in dealing with again the issue of pulang kampung or mudik or going home village, mudik more specifically being reiterated by President. So the first step is that to announce to the people, urging the people not to going home village. Then the campaign was done in a massive way through many features and many channels. A lot of people speaking loudly to urge people, particularly in the Jakarta and surrounding areas, what we call is Jabodetabek, one source of people for going home village, not to go. Then within 2 weeks of announcing and urging people not to going home village, the government conducted a survey, number of surveys actually. Then those surveys explain that the intent of the people for going home village is going down. This is a good result. And finally, Bapak Presiden Jokowi announced very explicitly to ban the people who are going home since the beginning of Ramadan. Then you have got the police and some other state apparatus on the street, show of force. They forbid people, buses, and other transportation and stop randomly people whether they are going home or home village or not, or to do something else, which is very strategic or very important, such as health and food and supply and so on. So when they are recognized with the intention of going home village, then the bus is prohibited to carry on, then to return to Jakarta. So based on the number of survey, again, the intent and the number of those want to go home village decreasing from time to time, even though some of them already gone home. But those returning to their home village, actually those already lost their jobs in Jakarta. So rather than staying in Jakarta, doing nothing, and they have to pay a rent house or renting a room, and for their own cost living in Jakarta, better for them to let go home to the home villages. But the number of them, since we have got a very intense campaign for banning them or asking them, urging them not to go home village, so the number of them is trickling rather than flooding. So the capacity, in the meantime, we also instructed all local government from province, regency, cities, even to all villages to provide quarantine. And you know, Indonesia again is blessed in terms of social culture. We are a culture with the social interaction and relationship close one another rather than individualistic and all selfish. So we have got specific administration in all villages where you have got head of village, which is recognized officially in our bureaucracy, in our government systems. Then they are the one in charge of regulating any affairs in the villages. So in their own village, we are instructing them to apply the protocol of ODP or people under monitor to those relatives or friends going home village from town or cities, from Jakarta particularly and Greater Jakarta. So they applied to do self-isolations for 14 days. But if those people do not have their own specific room to isolate in their houses and villages or towns and regencies providing facilities such as schools, facility of education and training belong to local governments, even renting hotels, converting hotels to be quarantine facilities, being paid by the local government based on the reallocating budget. So you have got two benefits. Number one, providing quarantine, and at the same time, you assist also hotel to survive, even though in a low level compared to the normal time. Then, from 7th of May, or 3 weeks before Lebaran or Hari Raya, 7 May, the show of force will be increased step by step by state apparatus, particularly the police, and also of some officials from Department of Transportations, security apparatus, show of force in order to provide a deterrent effect for those who intend to go home village. Even though you know that sometimes people have got a lot of tricks to go home. Yeah. Well, maybe some of them can go through, then finally reaching their home villages, but the number of them reaching their home village much lower than doing nothing or having no ban and so on. In the year 2019, we have got around almost 20 millions of those going home village or mudik. But now, based on the survey, we are researchers already told us around 1 million already gone home. But again, the capacity of local government, including head of villages, providing self-quarantine sufficient. This is still below their capacity. Rather than being flooded by those mudik, people of mudik. So I think in terms of management of going home village for the time being, quite good so far. The second one is that in relation to the social distancing or physical distancing, well, we have already announced and also brief heads of local government how to apply physical distancing, social distancing, and restriction for social gathering. But in terms of restriction of social gatherings, decision is being made by law by Minister of Health. So local government can judge the situations whether the danger of epidemic is high or medium or low, if they think it is high, they can propose to the central government, particularly the task force. Professor Wiku could explain further about this. And finally, the decision being made by Minister of Health. So this is our systems working. But physical distancing, social distancing, wearing mask, washing hands, and so on, widely briefed by head of local government and to their own citizens. So what we need to do is that to brief more details. A lot of innovations already made actually by local government, such as, again, I would like to answer one question as well in relation to the wet market. In the wet market also, some local government do not ban, but provide a space in which physical distancing could be applied. Same thing like the one being applied by Vietnamese government. So you've got wet market with box, with painting, so that you have got a space. In the queue up also, you have got space 2 meters with paintings. In transportation also, you have got, you are allowed public transportation, but again, health protocols, hand sanitizers, disinfectant, decontaminated the mode of transportations, and arranging the seats so that you have got this distance between passengers within the range of minimum of 2 meters being applied. But then, since Indonesia is a huge country, huge population, 260 million people, well, it is not easy. And overmore, we are an open and democratic society. We are not authoritarian country. So you have got the iron fist to citizens. It's democratic society, open society. Persuasive means being applied in parallel, sometimes with hard measures. But you cannot do just hard measures. And the next questions in relation to the, well, this is praying. A lot of questions on praying. Some prayers still being done in massive number. This is one of the challenge of Indonesia. You know, we are a country that recognize official religion, and everyone must have religion in this country. So anything to religion is very sensitive. We have to be very careful in making policies in relation to religious affairs. We have urged, we prioritize persuasive measures rather than hard measures or coercive measures, specifically for religious related activities. We already discussed with two organizations relating to religion. Number one is Majelis Ulama Indonesia, Indonesian Ulama council, particularly in relation to religion of Islam, and number two, communication forum for religion, FKUB. So, in order to brief them and share with them, we are not banning religious activities, but the problem is that any mass gathering or social gathering in a massive number, this is very dangerous because it is very potential media for widespread of the virus. So informing, sharing, or educating, if you like, to the people, particularly in the religion-related gatherings, it's not really easy. In the case of Aceh, for instance, they have got a very strong tradition embracing religion. So talking with them, discussing with them on the danger of mass gathering, including praying, need to be done very intense, rather than, again, just, coercive measures that could be counterproductive. So building awareness. In the case of Aceh, there is a question on showing the pictures on mass praying in Aceh. Well, Aceh is still in the green or maybe yellow or green area with a small number of confirmed cases and only, well, it's not only one fatalities. Even though it is a signal for us, to be aware, given the fact that again the graph of contagion is exponential. It is a still green area. We have to explain to, particularly to the religious figures in Aceh, again on the danger. And we work together with the heads of local government. I talked to the governors. I talked to the governor of Aceh, a number of bupatis and wali kota in Aceh personally, informing the danger and how to approach the religious leaders, because the role of religious leaders in Aceh is very, very strong to the people. Again, persuasive measures is being prioritized rather than coercive measures. But to some extent, when we found that this area is really red and mass gathering is a problem, then we could do the coercive measures like the one we have done already. If you remember that Jemaah Tabligh in South Sulawesi, I talked to the chief of police over there. I talked to the governor very, very strongly. I said, well, are you taking the lesson from what happened in Malaysia and South Korea, where the outbreak is really rising because of the religious gatherings? I said, there is no way you have to do it coercive measures now. I talked very strongly again to the governor, Bapak Nurdin Abdullah, and the chief of police, Major General Muktiono. And they executed. They dismissed after talking quite in strong debate with the religious leaders over there. The final question well, I think I have already answered most of question. Oh yeah, the last one is that in Jakarta, whether ojek is still available? Well, you know, the government already banned ojek to take passengers, but ojek still go on. They can carry on as long as for delivery, such as food delivery or restaurant delivery or health items delivery or whatsoever, online shopping delivery. But they are not allowed to take passengers. So if you see the people taking, driving motorcycle with passenger, it is likely that they are actually immediate family of the driver. We are allowing immediate family, such as husband and wife, of course. Why we do that? How we could distinguish stop randomly, in random by the police. I already talked to the chief of Jakarta Police, discuss about this. He said already instructed all traffic police to stop motorcycle with 2 passengers or 2 drivers, right? With 2 people over there, whether they are related or not. If they are not related, they are not immediate member of family, then they are fined. Yeah. They are being ticketed. But if they are immediate family, husband and wife, well, they are okay. Why? Anyway, when they are in the house, even they sleep in the same bed. Thanks very much indeed.
Good morning, colleagues, foreign press correspondents, Minister of Foreign Affairs, Ibu Retno Marsudi, and also Bapak Tito Karnavian, Minister of Home Affairs. Thank you for having me here, and thank you for the consistency to inform public and the world how important is unity and solidarity, gotong royong in pandemic response. This is what is displayed today. Our external affairs lead, our internal affairs lead, and you, the media, and I, the scientist, get together here to find best ways to inform the public, both at home and also abroad. I'm Wikwa Disasmito, the lead expert of the COVID-19 Response National Task Force. I speak before you to represent Pak Doni Monardo, the chief of the task force. First, colleagues, I would like to mention that Indonesia is recognized, among others, for 3 things. The world's largest archipelagic nation. The second is the 3rd largest democracy in the world, and one of the most decentralized country in the world. Since 1945, 75 years ago, we called ourselves and proclaimed to the world as Unitary Republic of Indonesia or Negara Kesatuan Republik Indonesia. That cement the foundation of the national and regional collaboration on almost every aspect of our lives, especially in responding to pandemic COVID. The National Task Force is structured in such a way to always have close coordination with the regional task forces, both in the provinces and district and also municipalities. As of now, 34 provinces have established the provincial task forces, and hundreds of districts have their own task forces. Almost all led by their governors, mayors, and bupatis, or head of the districts. For those who have not led by their local government leaders, the Home Affairs Minister have given time for them to revise their structure. This is to make sure that the task force reflects fully the nation motto, Bersatu Kita Teguh, or we are stronger together. Now I will answer questions that were relayed by the international media colleagues. First up, questions from Sydney Morning Herald regarding the Indonesia's partners, collaborations, and joint ventures in mitigating COVID-19. To reach the amount of tests needed to be performed nationally, Indonesia government both receives and makes purchases of RT-PCR and RDT antibody kits. Indonesia received help from both government organizations, non-government organizations, and also private sectors. The RT-PCR kits with its necessities and RDT antibody kits were bought from companies in several countries such as South Korea, the United States of America, China, and many else. A lot of countries have provided help for us in regards of test kits, but we selected ones which listed in WHO COVID-19 pandemic emergency use listing for in vitro diagnostics, certified by CE, FDA, or equal certifications that have specific targets to SARS-CoV-2. Up until this week, the government of Indonesia has distributed around 1,403,000 PPEs, 128,000 N95 masks, and 438,000 rapid test kits across Indonesia. The President has instructed to provide a guarantee of acceleration of logistics distribution for medical and essential needs between regions. On top of that, Indonesia is now preparing to make our own RT-PCR and RDT antibody kit, and so does for the PPE. Moving on, addressing questions from Straits Times, NHK, Moroccan News Agency, regarding Indonesia RT-PCR current testing capacity and 10,000 tests that were targeted to be done, and what next. As per today, there are already 46 laboratories around the country that have been actively conducting COVID-19 testing. Those labs are from the Ministry of Health, Ministry of Agriculture, from the Indonesian FDA or Badan POM, and laboratories from the private laboratories. We are doing our best to increase the capacity of testing by laboratories from outside Ministry of Health joining the COVID-19 testing lab networks. We call it a second line of defense. So we have the first line of defense, and then we also have the second line of defense. We already reached 10,000 tests per day as daily maximum testing capacity. Even though we already reached that number, there are still several situations that need to be improved. Delay in reagent distribution, testing queue, lack of resources affect the time needed to increase the testing numbers. We are increasing testing capacity and reduce the queuing number for the time ahead. Next list of questions are from China Central TV, Sky News, AFP, regarding issues of global learning of COVID-19 mitigation. Also on our efforts and intervention in order to tackle the peak. We always monitor the cases from other countries. We also learn how to respond quickly in flattening the curve. For instance, in China, they make the regulations from total lockdown. Meanwhile, in Indonesia, we are implementing so-called large-scale social restriction, or PSBB. They also built the makeshift hospital, while we also built an emergency hospital in Galang Island and utilized the Wisma Athlete as centralized quarantine. China also has adopted several stringent measures to combat the COVID-19 during the Spring Festival 2020, whereas in Indonesia, the government of Indonesia has decided to ban traditional mudik, which is exodus, by prohibiting all the flights, other transportation, which has been stated in the Ministry of Transportation regulations. However, there are several categories of businesses and activities that are permitted to operate during the PSBB, but should obey the health protocols, which have played a big role to fulfill our essential needs. Some modes of public transportation continue to operate as they should, with a reduction in the number of the passengers and always keep clean and distance. During PSBB, we as a community must remain alert and maintain our cleanliness in order to prevent COVID-19. The main activities such as study and work also must be carried out at home. Therefore, we need to foster individual and collective discipline behavior as the main factors to not drive the peak infection back. The next question is from ABC in regards to region-specific questions. We appreciate the precise attention specifically for Papua and Bali that have been known to have many potential to solve problems in their special way, as same as the other regions. With the uniqueness of each of these regions, our integrated data system Unite Against COVID-19 or Bersatu Lawan COVID-19 encourages fast and effective coordination all around Indonesia. Hence, the data transparency is the main navigation in Indonesia, parallel with the people-centric policies, from the grassroots to the highest level, working together as the main strength of our nation. Especially in Papua, we are fostering local leadership for the significant results of tracing contact and also people management to stay away from the stigma. Ensuring the quality of health care is very essential for case control. Meanwhile, in Bali, local leaderships and also the culture over there takes major game for these pandemic situations. They are embracing the cultural perspective to combat SARS-CoV-2 threat. Now, moving on the next list of questions asked by our friends from NHK, CNA, Straits Times, AFP, and Morocco News Agency. We have received the highest attention in regard to numbers of cases and patient classifications by PDP, ODP, OTG, and so on. So, we have a difficult task ahead of us. Bear with us. More than ever, the idea of an integrated data across the nation cannot be avoided anymore. Now, we are currently compiling data from all levels, such as primary healthcare, hospital, laboratory, and district and city provincial health offices. Close coordination with the Ministry of Health, Ministry of Communication and Information, Ministry of Home Affairs, and also with the regional task forces. Yesterday, we launched an integrated system accelerating data integration called Bersatu Lawan COVID. The system can record the data real time and facilitates the public to get information by accessing covid19.go.id. By accessing the website by the public, can get many information such as sex, group of age, symptom, and also comorbid. And we hope that we can give more new information to the public related to COVID-19. However, please bear in mind, in the process of integrating the data, the public should be prepared to see some changes in the data. All the efforts to improve the data validity. Questions from New York Times, Morocco, NA regarding Government of Indonesia prediction that Indonesia will be back to normal in July, estimations of the human and economic balance sheet during the COVID-19 crisis. I want to make sure that there is no trade-off between the economy and public health. We know how to bring the economy back to life, but we don't know is how to bring our deceased patients back to life. Human life comes first. Within 2 to 3 months, we have to control the economy's bounce back. We are now in progress analyzing and mapping the scenarios for the restart and reopen economic sector. Last but not least, a question from Morocco News Agency, the situations of children vaccination during this pandemic. In the condition of this COVID-19 pandemic, other health services must continue to be carried out. Vaccination health remains a priority in tackling other infectious diseases in the future. Therefore, in the contagion COVID-19 area, if it is not possible to be immunized, it can be delayed for up to a month. Now, allow me to close this with a message from Bapak Doni Monardo to everyone in all corners of Indonesia and beyond. The community must remain alert, be vigilant, and maintain personal hygiene, stamina, and collective health in order to break the chain of infection. Stay at home, study, work, and pray at home. Wear masks to protect yourself and protect others. Keep your distance with others, and kill the virus by washing your hands with soap and running water. Save lives, protect the most at risk, the elderly and those with serious health conditions. For Indonesian at home, obey PSBB. It will save your neighbor, your city, your province, your country, and do not mudik, because it will disrupt the nation's food supply. Our cities are built from villages. They are the true backbone of our economy. Please keep our parents, siblings, and the villages healthy. Keep them safe, save the village, save the nation. For the Indonesians abroad, follow the local government's instruction. We are all in this together. We will get out only with the collective efforts, everyone. We need to strive toward an unprecedented unity within this challenging time. As I quote from what Ibu Retno always said, stay healthy, stay united. Thank you.
Well, thank you very much, Pak Tito. Thank you very much, Pak Wiku. So, colleagues, this is the end of our briefing today. Once again, thank you very much for being with us today, and see you next week. And to conclude, Ramadan Kareem, stay strong, stay healthy, and stay united. See you next week.